Hi, and welcome to the New England Hemophilia's Webinar Wednesday series. My name is Sarah Shinkman, and I am NEHA's Program Director. I will also be the moderator for tonight's webinar. As we navigate the current health crisis together, our primary concern is the health and wellness of the individuals and families we serve. Being connected with each other is more important than ever. While we may be practicing physical distancing, staying healthy means not falling into an unhealthy pattern of social isolation. Our goal is to keep you as informed as possible. That's why we launched the series. For the foreseeable future, NEHA will be hosting an educational forum at 7 p.m. each week called Webinar Wednesday. Tonight's webinar is all about medical marijuana and pain. As cannabis becomes more mainstream, it is important to understand how those with bleeding disorders may incorporate it as part of their treatment program. This session covers the history and legalization of marijuana, legal implications while using and researching cannabis, and specifics on how to access and use cannabis legally. We are thrilled to welcome Michelle Whitcop from the National Hemophilia Foundation, NHF, as our speaker for tonight's webinar. As the head of research, Dr. Whitcop, a doctor of nursing practice, leads NHF's research initiatives. Her background includes extensive experience and research in pain management, including chronic pain and palliative care. Prior to joining the bleeding disorders community, Dr. Whitcop was employed in a chronic pain practice and was board certified in palliative care. She has also been the principal investigator or co-investigator for multiple hemophilia pain research studies, including the National Pain Study and the Impact Quality of Life studies, and has published multiple articles as well as lectured extensively. She is a past chair of and continues to work with MESA Pain Initiative Subcommittee. Again, we are thrilled to have Michelle join us for tonight. Clearly, her extensive experience makes her a wonderful speaker. NEHA would like to thank NHF for their support of tonight's webinar. NEHA is a chapter of NHF and partners on many initiatives, including educational web programs and webinars like this one. Before we get started, I'd like to go over a few webinar points and helpful hints. Tonight's webinar will last approximately 1 hour. We welcome your participation and questions. Your audio will be muted by the system for the duration of the webinar. If you have questions, we encourage you to use the question box on the bottom right of your control panel. I will pass these questions along to Michelle at the end of the presentation. Michelle, before I turn it over to you, we are going to do a couple of polls. I would ask that everyone pull out their phones as I pull up some of the questions that will help navigate our call tonight. So bear with me just a minute. I'm going to turn from the PowerPoint that we have to the Swift polls that we'll be using to gauge your participation. Okay, my screen can be a little delayed, so apologies if you don't see this immediately. Okay, so we're going to ask that everyone pull out their cell phones if you haven't already and text the phone number 781-412-7971 and just let us know what is one thing that is keeping you motivated at this time. We always like to get started with a question like this just to kind of see how folks are doing. It's a word cloud, so you'll see your responses populate in real time, and themes that we see more people responding to, you'll see kind of get a little bigger in the cloud. So you can already see that NEHA is definitely high up on the list here. Love that the cats with the heart emoji, spring, bleeding disorders community, running, my family, fish. These are all great things. God, the gerbil on here. Thank you guys for your participation. And we realize that by doing these webinars, we don't always have a chance to see you. So by doing this, it allows us to be able to have some participation from our audience right off the bat. So it looks like NEHA is keeping strong here as kind of our lead, and families a close second. See things like hope and exercise. No other option. I think that's certainly understandable. This is kind of how things are right now, and we're so glad that you guys were able to join us for this webinar to give you some education during this time that we can't be together. So I'm going to move on to the next question just to be mindful of our timing here. So bear with me, my screen will move and I'll start the next question. Okay, so again, we always like to do a mental health check-in. So I would ask that you please respond by texting one of the numbers that corresponds to how you're feeling. So number 1, I'm doing really great. Number 2, I'm doing pretty good. Number 3, I'm doing okay, I guess. Number 4 is I'm starting to struggle. Number 5 is I'm really having a hard time. And number 6 is I need to reach out for help. And I see that number 3, I'm doing okay, I guess. It looks like the majority of respondents are sharing, feeling that. And then I also see that I'm starting to struggle and having a hard time and I need to reach out for help are also things that people have responded to. And I should say that the responses that you share in this are completely anonymous. We really appreciate the participation, but please know that, that your responses are not being recorded. It is anonymous. I will say for anyone who does need additional support and needs to reach out, Neha is here for you. We'll make sure that we share the information for how to contact us at the end. But please know you've got a large family behind you and we're here to support you. So let me move on to our next question here. So the following 3 questions we have are going to be related to our presentation tonight. So this one is, what state do you live in? So we have, of course, Maine, number 1, Massachusetts 2, Connecticut 3, Rhode Island 4, Vermont is number 5, New Hampshire 6. And if you live outside of the New England area, you're number 7. We're asking this because as part of the presentation, Michelle's going to share a little bit about what states in the New England region have legalized medical marijuana. And so it's helpful for her to just get a sense for kind of who's on the line tonight. So it looks like we have representation from each area in New England, which is really fantastic. I see that the our 2 largest states with representation are Massachusetts and New Hampshire. Thank you for responding to that. Okay, so our next question is, again, just to kind of gauge where folks are at, how knowledgeable are you regarding medical marijuana? So if you consider yourself an expert, hit 1, text 2 for very knowledgeable, 3 for moderate, 4 for basic understanding, and 5 for unfamiliar or new to the topic. And this will help Michelle kind of get a better sense for where folks are at in terms of their understanding for this topic. So it looks like most people are saying very knowledgeable, moderate, although I think basic understanding seems to be kind of in the lead as far as the majority of folks. Great. Thank you guys for responding to that. All right, we're going to move on to our final question here. So we're asking folks to share, do you use medical marijuana currently? We have text 1 for yes, 2 for no, and 3 for prefer not to answer. Once again, this information is completely anonymous. This just helps gauge Michelle's direction and help us to kind of better understand what folks' familiarity is with the topic on the line. And I should say, you can hit 3 for prefer not to answer, and you also don't have to answer at all. So thanks. I'll just give that another second. And it looks like we've got almost 50-50. Well, 40-60. Yes, 40%, and no, 60%. So a nice mix of folks in terms of both familiarity and use of medical marijuana. All right. Well, once again, thank you all so much for sharing the information here. So at this point, what I'm going to do is turn it back to Michelle, and she will start going through her presentation. Once again, if you have any questions, please feel free to submit those into the question function. Everyone's lines will be on mute throughout the duration of the webinar, but if you submit a question in the question box at the end of the presentation, I will announce those to Michelle, and she will share more information as we go along. So once again, thank you all so much for joining us. A huge thanks to Michelle for being on tonight's webinar and sharing her expertise. And Michelle, I'm going to go ahead and give you control of the screen.
All right, thank you. Okay, so let me move this over here, and I just want to make sure you can see my screen.
Yes, I can see it great.
Okay, perfect. And you can hear me all right, obviously. So thank you so much. I thought that was really cool, the polling, how you did that with the word cloud and everything, and it was very informative too. So I do appreciate that. And tonight we're going to talk about just the history of medical cannabis, its effects on your body. We're going to review some of the use, how-to type of things, and then some special considerations and legal ramifications. So first off, history. Cannabis has been around for eons. They have found samples or cannabis in archaeological digs that are at least 3,000 years old, from what they believe to be shamans or medical people from that time frame. And it has survived throughout the ages. So it is not anything that is new. We see from a historical perspective that as long ago as 1850, it was on what we call our US pharmacopoeia. And that was a list of medications and the reasons why you would use those medications. And it was included for both physical as well as psychological conditions. And it was widely available and widely used until the 1930s in the United States. And at that time, a federal tax was applied to it. They put out a $10 tax, which was a huge tax. When you think that they were probably making 10 cents an hour, $10 for a tax to be able to utilize this was an enormous tax. And then its use was restricted to mostly industrial, and that is for the hemp part of it. The AMA, the American Medical Association, strongly opposed this taxation. And in fact, I've read the transcripts from the head of the AMA. His name was Dr. Stanley Wood, who testified in front of Congress to say that we really should not be taxing marijuana. We should be researching it because it is a medicine. And all of our medicines at that time came from herbs and came from plants. They weren't reconstituted the way they are now, where we develop them and make them in a laboratory, many of them. At that time, they came from a very natural source. So it was very political. There was a lot of immigration. Marijuana was used by many of the immigrants who were coming into the country. And it was felt that we needed to hold back on not only immigration, but the practices of the people who were coming in. And so that is what really brought about this taxation. In 1970, Richard Nixon signed into effect the Controlled Substance Act. And again, this was against the suggestions or the counsel of the medical community. And while this repealed the Marijuana Tax Act, it scheduled marijuana as a Schedule I drug. And we're going to talk about how medications are scheduled and where that falls in the federal scheduling of that. But it essentially made it a drug that was unusable. It was not something that could be prescribed, and it couldn't be used. It became an illegal substance. The National Commission in Marijuana and Drug Abuse actually, 2 years later, came out with a recommendation that said, you know, this is ridiculous, that you shouldn't have that type of scheduling, that we should lower its schedule, we should lower its penalties, but that has been ignored, and it's been consistently ignored by all of the subsequent administrations since then. In 1996, they did develop a Compassionate Use Act and started to do a little bit of research on it at that time, and actually developed a field where they would grow marijuana. And this is in Mississippi. The University of Mississippi has the only legalized field where research grade marijuana can be grown and utilized. And from that point forward, California became the first state to legalize medicinal marijuana. And you've seen state after state legalize medicinal marijuana until 2014, when Colorado became the first state to actually legalize marijuana at a state level for recreational use. Now, going back to that drug scheduling, this is actually maintained and administered by the Food and Drug Administration, the FDA, and they look at all medications, and if they look at their acceptable medical use, the potential for abuse, and the potential for physical dependency. And if they fall into any of those categories, then they schedule them. And how they schedule them, as you can see, the lowest schedule down here, Schedule 5, is for things that have a potential for abuse, but is very small. Many of you might be familiar, if you have any pain issues, with Lyrica. That's used often for pain, but it's a Schedule 5 medication, and there's some controls over it. Schedule 4, you have, again, some medications that a lot of people feel have more issues with abuse and misuse. And these are a lot of your benzodiazepines, your anti-anxiolytics, your anti-anxiety medications. Soma, which is used a lot for pain, is considered a Schedule 5, but a lot of people have issues with that when it comes to abuse and misuse. Then you get into your Schedule 3s, your anabolic steroids. Ketamine, which can be a highly abusive medication, is only a Schedule 3. Then you get into your Schedule 2s, which if anybody who has pain, they're going to be familiar with this, because your hydrocodone, your Norcos, your Vicodins, these are Schedule 3s. Oxycodone, OxyContin, Dilaudid, all of those, as well as your stimulants, are a Schedule 2. I'm sorry, I said Schedule 3, but it's a Schedule 2. And these medications require that you have an in-hand prescription. They generally can't be called in. You can't have refills on them, and that has to be signed by a provider. So that's the highest schedule, a Schedule 2 medication that you can have prescribed for you. When we get into a Schedule 1, you can see here that a Schedule 1, oops, I'm sorry. There we go. A Schedule 1 is where marijuana or cannabis is included, and that's included with heroin and with LSD, highly abused and illicit drugs. And that's where marijuana was put from the very beginning, and that's where it has stayed since then. Sometimes people ask, what's the difference between marijuana and hemp? And they both come from the cannabis plant, but there's a difference between the subspecies of it. And basically, the difference comes down to the THC, the level of the psychoactive component of the plant. The psychoactive component basically comes from the leaves and the top of the plant, whereas the hemp part is more of the stem and the stalk, and can be used for different things like clothing and textiles, ropes. And recently, well, I shouldn't say recently, in 2014, the Obama administration moved some hemp issues to make it less restrictive. But there still were a lot of restrictions around it. It could only be used for some industrial things. In 2018, the Trump administration, and this was a bipartisan effort, and it moved through Congress and the Senate very quickly, and was approved in December of 2018, where they removed hemp and CBD from the restricted, or that scheduled restriction, the Schedule 1 restrictions. They separated it. So that was really the first time that you saw a separation of marijuana or cannabis that had a higher THC count and hemp or CBD, which had a lower THC count. So anything that has a THC count less than 0.3% is considered hemp or CBD and was classified more as a food, and it was removed from the Controlled Substance Act. So that's when we started seeing CBD infused into everything, and a relaxing of all of those restrictions around CBD. We started seeing it on the shelves, in gas stations, everywhere. And that's the difference between marijuana and CBD, is basically the THC count. When we talk about cannabis and the cannabis that, or the marijuana that was used in the 1960s and the 1970s, it's incredibly different than it is today. Today, there are over 600 strains, and I always think of, though, the people that we thought of as potheads in the 60s and 70s, they have become our cannabis chemists. They have sliced and diced these different strains so that they're very focused. You can have strains that are particular for anxiety, for sleep, for pain. And you can go into a dispensary and you can tell them what your needs are, and they'll be able to give you a product specific for your needs. And it's because of all of this hybrid products, these hybrid plants over the years. But from that, what we had in the 60s and 70s, where it was the THC content of a joint or a cigarette was maybe 10 milligrams, now you can get it up to 60, even 150 milligrams. And so it's much more potent now than it ever was before. And that's where some of the problems are arising from. So we're going to take a little bit of time here and talk about the legal system around cannabis. Where is it legal? Now you can see over here on the far side, the far left side, if you're looking at the screen, where it is fully legal, both recreational as well as medicinal. And for the NEHA group, Maine and Massachusetts, it's fully legal. From a medicinal standpoint, it is only legal in Connecticut, New Hampshire, and Rhode Island. The difference for you, when you think, if you're in a state where it's fully legal, the difference comes into taxation. If you have a medical card, you're going to get taxed at a different rate than if you buy it out fully at a fully legal rate. So that makes the big difference of having a card in those states where it's fully legal. We've also seen public opinion changing tremendously, and I would say in a very short period of time. When you look at just the support for legalization, from not the medicinal part, just the legalization for recreational, it has doubled in the past 20 years. 62% of adults support marijuana use. When it was asked about the most frequent methods for using in 2017, smoking and vaping were the most frequent methods of utilizing it, as well as eating and then dabbing. Now, we have come to know in the past year and a half that vaping can have a lot of untoward consequences, even more than smoking. Smoking, we know long-term, we know the consequences, but vaping has a lot of sudden onset side effects that were previously unknown. So there's a lot of concerns with that. And adults that have medical conditions are using it much more frequently on a regular basis across all age groups, except for those older than 65. So when we talk about it being legal in a state like Massachusetts or Maine, we need to understand that it might be legal at the state level, but it's still illegal at the federal level. And that really creates a lot of what we would call dissonance or difficulty, because if you have any type of federal assistance, if you live in federal housing, if you have a federal job, if you get a federal grant or loan, if you're getting a federal scholarship, and you are using, even if it's legal in your state, those can be taken away from you, or those can be at risk. So you really need to be cautious if you have any type of federal assistance at all. Recently, last July, both the House and the Senate introduced what is called the MORE Act, the Marijuana Opportunity Reinvestment and Expungement Act. And again, this is the most recent and the most strongly supported act to try and decriminalize marijuana, to try and take it off from that controlled substance list. And what they want to do, if this goes through, and it has moved through fairly quickly, it's gone out of committee, the last I had read about it, and it's moving, through the process that it needs to move at a federal level. But what they would do is they would remove it from the Controlled Substance Act. They would decriminalize marijuana federally, and then let it go to each state to determine their own policies. So they would recognize and honor each state's ability to determine whether or not marijuana is legal medicinally or recreationally. The other part is for veterans. Right now, because most of veteran care is all at a federal level, they don't have access to medical marijuana, and they could lose their services, their federal healthcare services, if they were to be tested or to use it. So this would abolish any issues that they might have also. If this were to go through, then there would be let me go back here. There would be an additional 5% taxation, and that would be over and above any taxation that comes at the state level. And this would establish a trust fund. What they would do with that trust fund is they would work to expunge any legal issues that people have had in the past. So people that have had just marijuana, marijuana cases against them, or marijuana arrests, they would expunge those arrests. They would work at getting them employment, especially within the marijuana industry. They would especially work in communities that have been socially as well as economically disadvantaged because of the marijuana industry. So they would really work to try and correct many of the wrongs that have been occurring throughout the years. Again, some of the legal issues that can come around with marijuana are focused on immigration. So we talked a little bit about if you have any federal assistance, how that might impact you. But then if you have any immigration issues, if you are here on a visa, if you have a family member or you yourself are trying to become a citizen here, even if you are here in a lawful or permanent situation as a lawful permanent resident here on a visa, even if it's legal in the state that you're in, even if you were to have a medical card, from a federal perspective, they can come and deport you. They can deny your renewal on your visa, and they can deny you admission and entry into the United States. So this is a huge issue for immigration law. And it's being used extensively for deportation. That is something that those who are working within the medical marijuana fields, or medical marijuana areas, I shouldn't say fields, but within the areas, are working hard against, is to have this, especially when it's legal at the state level, to not have the people within those states be unjustly criminalized because of their use. So what about research? There are a lot of barriers to research with marijuana, and this is because it is a Schedule I controlled substance. And we see studies out there, but many of them are at a level that are not controlled. Of course, the best research that you could hope for is what we call a double-blind, randomized, controlled, placebo-controlled study. So that you have the sponsor of the study has control of the medication that is being given to the participants. So they know exactly the quality, the strength of the medication. They know exactly when it's given, how much is given, so that they can monitor for the effects of that medication. And right now we can't do that. Because if they do any kind of research, they can't control for the product or the marijuana that the person is using. All they can do is say, tell us about how this affects you. We're going to monitor you for side effects, but you have to go get your own product. They can't tell people where to get it. They can't control what that product looks like, how much THC it has in it, where it was produced, or anything like that. So that makes research very, very difficult. There, again, like I mentioned, there is that one field in the University of Mississippi that is the only FDA-approved source, but it's very difficult to get approval through the DEA or the FDA to be able to utilize any of that product. And it can take a long time to get any type of approval for that research grade product to be available. So when we think about those barriers, if anybody were to try to control the product that a person used in a research study, they could be held and prosecuted for that. And it just makes it difficult for them to really understand the effects. They try to, and you're seeing many more studies on the side effects of medication and that coming out, but it isn't the type of research that people in our community are used to, you know, the type of research that we see with our clotting factors or anything like that. So what do we know? How does it work? What we don't know far outweighs what we do know. It's interesting in that when we talk about opioids, the pain medications, there's a system within your body, the opioid system, that those pain medications block. And we've known about that opioid system and all of those receptors since the 1800s, the late 1800s. But it was only in the 1990s that we found out about the endocannabinoid system and found out that there are receptors for marijuana in your body. And basically, the primary function of those receptors is to maintain balance. And we call equilibrium that balance in your body. So that balance is for many different areas. It isn't one area. It isn't like it's just pain or it's just neurologic. We know that cannabis is extremely effective for seizures, but it isn't just for some areas like that. In the very early stages when they were, you know, years ago when they were looking at cannabis and really saw that it helped in the HIV population. They started, and people would say they got the munchies from it. One of the early studies looked and thought, all right, so there's this endocannabinoid system, and if we could block some of those receptors and prevent people from getting those munchies, then maybe this would be a good weight control medication. And what they quickly found was that people became hugely depressed when they blocked the endocannabinoid system. And then they started realizing that there were other receptors in other areas that this maintained. So that's as they started learning more and more. So really, it's only been 20, 30 years that we have started understanding the full, and I can't even say that we have a full understanding of the endocannabinoid system right now. It is very integrated within our body. It's not something that we have a set amount of receptors. As our body needs them, it produces these receptors, and we have endogenous, so these receptors within our body that are natural, and they connect with exogenous, or those cannabinoids outside of our body, the THC and the cannabidiol, the CBD, and they act as a lock and key to produce the effects that we talked about back here. They maintain energy, they help with metabolism, they help with your GI function, they help with pain management or pain perception, motor control. We talked about seizure and posture, things like your memory and emotions and learning, the immune response. We know right now about CBD1 and CBD2. These are receptors. Some are function mostly in your brain, and they control some of this, like your motor and your pain. The CB2 is more of the immune and inflammatory response, and they're more spread out throughout your body. But we have to realize that there's probably many more receptors that we just don't fully understand. We're starting to realize that there's quite a few in the cardiovascular area, and that there's quite a cardiovascular response with the endocannabinoid system. So definitely something that needs more research. And if we were able to decriminalize and deschedule marijuana, this would absolutely be an area that we would do more research in. So what is NHF doing to promote cannabis research? We have a community-based initiative where we are enrolling people through my BDC, and currently we have just under 600. We have a little bit more than that 583 that you see on the screen right now. And through surveys, we're asking, we have an enrollment survey, and then we have a baseline survey right now out. But we ask questions that help give us insight into what it is like to live with a bleeding disorder, both from the perspective of the person who's affected, as well as their unaffected family members, to get that 360 view of living with a bleeding disorder. And what we learned so far, and this is really the only information we have on medical marijuana in our population. We've had, so far out of 122 affected respondents, 17% say that they are using medical marijuana for symptom management. You can see over the far left side. And when we ask that 17%, what are they using it for? 95% are using it for pain, 67% are using it for anxiety, and 43% are using it for depression. So this is the first time that we've really had any type of understanding of what our community is doing from a medical marijuana perspective. And the other things that you see on here are some of the other questions that we ask about pain, and we separate it by gender. We ask about employment. There's a bunch of other questions. But again, this gives us a 360 view of what it's like to live with a bleeding disorder from that whole family perspective. And we hope with this information that we'll be able to enhance research, education, and advocacy. This is a data collection tool. It's not research in and of itself, but researchers will have access to this. And so if you are interested, please go to mybdc.hemophilia.org, and you can help us to understand how medical marijuana and many other things are affecting our community. So back in general, as we develop this slide deck, most of what we have is from other communities, from other literature. And we know, like what we saw in our small, very small sampling, that chronic pain is the majority of why people use medical marijuana. But there are other reasons down here. You can see it for sleep disorder, anxiety, glaucoma, seizure disorders. And there are advantages. From the little bit of literature that we have, we can see that there are advantages to using cannabis when compared to opioids or pain medications. There are some studies that show that it can be opioid sparing. When people use medical marijuana, they decrease the amount of opioids that they are using. It can help decrease nausea. It can help decrease depression. It definitely is not constipating like opioids are. And it doesn't have the respiratory effect that opioids do. Now, having said that it can help with depression, there's also a sweet spot. If people use too much or, well, I would just say use too much, then they can actually have more anxiety and can have more depression from it in a certain subgroup of people. So it's not that this is a panacea and is available for everybody and going to work wonders for everybody. Here's one study that looked at the people who had used cannabis as a substitute for prescription drugs. And what they found was that females used it more to substitute cannabis or medical marijuana for medications. And you can see it's pretty much in all age groups, but as you get into that 50 to 60 age group, and many of those people are from that era also who probably used it a lot more in the 60s, 70s, and the 80s. They're more apt to replace those prescription drugs. And looking at what drugs are replaced, opioids, benzodiazepines, antidepressants, those types of medications are the ones that are being replaced by the medical cannabis. There are adverse effects, and there are some people that don't want you to talk about these adverse effects, but again, this isn't something that is going to work in everybody, and it's also not going to, it can cause side effects. But when you compare that to the opioid, the potential for opioids, the side effects are generally not serious. You might have some nausea, some sedation, dizziness. The cognitive side effects or that memory issues, the judgment, coordination, those types of things are usually what you see most often. But again, that feeling of anxiety, paranoia, that's something to really understand. And especially in the, we're talking about adults, but in that male, teenage, young adult age group where schizophrenia might be more of an issue, they are, it's not that marijuana causes schizophrenia, but in that person who is at higher risk for it, it can unmask it quicker. And so it would not, you really do have to be careful if you have a person who is at high risk. They should not be using it. And in adolescence, I've often had people from a chronic pain standpoint ask about using marijuana in children. And that really is a decision that has to be made at a family level because pain will change the neurologic structure of a brain. And in and of itself, medication, the pain medication will also do that. And there's risks associated with it. And the same with marijuana in a young brain that is developing. It can cause changes in the structure of that brain. And you have to weigh the pros and cons either way. And that is something that has to be individual and made a decision made by the family. Cardiovascular, as more and more people are starting to utilize marijuana, you're seeing more cardiovascular side effects. And Most of it is that there are, again, those receptors in the cardiovascular system that are being targeted. If you have an underlying cardiovascular issue and all of a sudden you start having an increase in your heart rate, it can cause a release of different chemicals and it can cause heart problems. Again, not that the marijuana will cause heart problems if you don't have an underlying condition, but if you do have an underlying condition, it is something to take into consideration. The case studies that have been in the literature have been of people who have taken medical marijuana, usually edibles, and didn't feel an effect, took more, and then they started getting that effect, and it scared them, which then it caused, you know, their heart rate to go up, their blood pressure to go up, and then caused heart issues. You have to take those types of things into consideration. We've already talked about the potential for schizophrenia in that group that is at high risk. And then we already mentioned about the vaping. Of course, smoking is not a good idea, period. And then vaping now, you know, there was always that thought that vaping was a safer way to inhale. And we found that it is not. And they found that THC does cross the placental barrier. And so you should not be smoking if you're pregnant or if you're breastfeeding, because it will cross that barrier and your child will be consuming. So let's talk about how you can get it. Each state has its own requirements. So you, the audience, are from different states, and every state has its own requirement. This is for Massachusetts. They do allow a physician, a nurse practitioner, or a physician's assistant to write for the qualified recommendation. So you do need that certification. And in Massachusetts, once they have certified that you meet a condition, then and that marijuana will relieve those symptoms, then they give you a PIN, and everything is done online. It's only $10 in Massachusetts. I want to think in Rhode Island it was like $30 or something like that, but it wasn't very expensive. And again, you have to look and see what the requirements are for each of your states, and you have to find whether or not your provider feels comfortable. More and more, when a state first legalizes medical marijuana, you will find that many providers won't want to do it because they're afraid. Their DEA is at a federal level, and they're afraid that they will be punished at a federal level. But when they realize that they're not prescribing per se, they're giving a recommendation, and then it's up to you to get that medication, then more and more as it becomes more common, start feeling comfortable with writing for that medical card and the certification. In Massachusetts, as of May of last year, there were 50 registered marijuana dispensaries approved for sale, and look at how many patients they had. You can also identify if, as a patient, you can't either grow your own product or you can't access a dispensary, you can identify somebody to be a caregiver, and they can access it for you. And they had almost 300 healthcare providers registered with this system to be able to provide those certifications. Now, these are the qualifying medical conditions for each state. You can see Rhode Island doesn't have as many, but when you have chronic pain, that pretty much fits under, many of these are very generic, and they, almost all of them have a clause that that give you an out with something like a debilitating medical condition. So here's Massachusetts, and they've got more but then they have other conditions as determined by a healthcare provider that are debilitating, and debilitating means causing. And so that's pretty open. And if you've got a provider who is understanding, they're able to help you fit into one of those categories. Here's New Hampshire, and I had to, they had so many conditions that I had to start putting them all together to fit on the screen. So you can see cachexia, which is wasting, cancer, chemotherapy-induced anorexia or loss of appetite, chronic or severe pain, Ehlers-Danlos syndrome, which is can have a bleeding disorder associated with it. Nausea, many of these are very comprehensive. Here's Maine. Now, Maine, again, like Massachusetts, it's legal, but from a taxation standpoint, it might be beneficial if you feel that this helps you in some medical way to make sure that you get a medical card. And these are the conditions. But then they also have it in Maine, where if the provider feels, it's up to their sole discretion, and if they feel that there is a medical reason that cannabis is going to help you, then it's up to them to make that determination. Here's Vermont. They don't have as many reasons laid out, but again, you can fit almost everything in there. And then Connecticut, they had a ton of reasons, and again, I had to put them, I had to combine many of them because there were so many to be able to fit into the page. And many of them, in my mind, could be, I actually took a few of them out because they were duplicative. And they had intractable spasticity, and then they had another one regarding spasticity. So many of them were duplicative. Post-laminectomy syndrome is pretty similar to post-surgical back pain. So where can you get the products? I know we're running out of time here. Every state is different. They have state dispensaries, and the once you get a card, that is giving a recommendation. And in Massachusetts, they recommend either a 14 or a 60-day supply. And there's a limit. Each state limits as to how much you can have in your possession at a time. Almost all states have a caregiver role where somebody can purchase it on your behalf. And they all have home cultivation where you can grow your own product. And this all varies by state. So it's important that you find out from your state what the legality is. And all you have to do is put into Google your state name and medical marijuana program, and it'll pull up the information. Quality does matter, and whether it's CBD or anything else, you shouldn't be buying it online, and you shouldn't be buying it from a source that you don't know. Just like when we had that dog food incidents and people were buying dog food online, it was coming from China and was laced with metals, heavy metals, and we lost a lot of our pets. The same thing can happen here. If you're buying online CBD, you don't know where it's coming from. You really need to know where that source is. You should probably buy local, buy from a local dispensary, somebody that you know, so that you know how it was grown. In many states, they will certify. It was really interesting. I had the opportunity in Colorado to actually go into the some of the dispensaries, the medical marijuana dispensaries, as well as the legal dispensaries. And they track from the field right to the home, and you can see where that is grown, what type of pesticides are used, if any, all of that type of stuff. And that's important. The medical dispensaries now are able to tell you how many milligrams are in of CBD or THC, so that you have a good idea of what you are taking. You might be able to even find if it's been tested by a third party. The lab I went into, every lot they made, they pulled out a sample and it was tested by a third party, and that lot stayed until they got those results back. And it was not sold until they knew that everything was clear. So if you can see that they have something like good manufacturing practice, or the American Herbal Products Association. These are standards that are often used, not necessarily just for cannabis, but it's manufacturing type of standards, and people that follow those are following good practices. So those practices are just general standards that are important to know. And then also monitoring the cost, if there's any type of refund, and the type of customer service that you can only get from a local dispensary. I don't know how many places have financial assistance, but that certainly would be nice. And then when we think about toxicity, of course, how much you use, how often you use, your degree of tolerance, and how you're using it is going to determine that. So let's talk about that. Smoking and vaping, that is going to be your highest risk for, no, let me rephrase that. Smoking and vaping is going to have your quickest onset, has more pulmonary issues associated with it, but the onset of action is very rapid. It's in minutes. The absorption is going to be the highest, and you're going to have your, what we call your peak plasma concentration. So the concentrations within your body are going to occur quicker, and they're going to last anywhere from 4 to 6 hours. So that's the quickest absorption to your brain. The most toxic way where you see more problems with overdoses or side effects are from oral ingestion, from edibles. And the reason being, let me go back here. The reason being is that there's a much slower absorption, that it's a very unpredictable onset, and that peak plasma level, where with smoking or vaping, you get it within minutes, this can have a delayed onset of several hours. And so people don't feel that effect, so they take more. And they still don't feel that effect 20, 30 minutes, so they take more. And then all of a sudden, everything hits them at once. And then they start having side effects because they've taken so much. So that's something always to be concerned about if you're using edibles, is that you set yourself a guideline and you say, all right, if this is the first time I'm trying it, I'm only going to take how much, one or a small amount, very prescribed amount, and I won't repeat it for 4 to 6 hours. And I'll do this for today and tomorrow. And if that doesn't work for me, then I will increase it to 2. But you have a very specific pattern as to how you're going to do this, that you write it down and you have your plan laid out. You don't just haphazardly just keep taking them because of you don't feel the effects. That's when people get into trouble. Topical is another way that people can take this. Rubbing it onto a specific area. If you have a joint problem from frequent bleeds, you can just rub that right into that joint, and it absorbs into the area, but you don't get that systemic side effect, that that overall body absorption. And so a lot of people find that topical works well for them. Always start low, go slow, and be patient. Have a plan in place as to how you're going to start using this and how you're going to progress. And don't deviate from that plan, because that's when you start getting into problems. Make sure that somebody knows what you're doing, and wait a period of time before you make any adjustments. And what I've heard, I have to say, I'm not an expert. I am just an interested provider. And I went, when I first started getting interested in trying to understand this, I was in the pain clinic, and we started drug screening our patients. And the people who were coming back positive were those people who were in their 50s and 60s. And sometimes older, and it shocked me. But they were from the 1960s and the 1970s, and this was part of their routine. And I would tell them that we are not going to continue your opioids. You know, at that time in Michigan, where I'm from, medical marijuana wasn't legal. And I'd give them a month to clear the marijuana out of their system, come back and get rescreened. And invariably, they would come back and they would tell me, you know what, I get better pain relief from my marijuana than I do from my opioids. So let's talk about getting rid of the opioids. And that's when I started realizing that maybe there was something to that. And I started talking to people. And I found a lot of people who worked at very high level positions and were able to do that without any problems. They didn't have to feel high. They would probably take 1 or 2 inhalations in the morning, 1 or 2 at night. It would help them sleep. It would help them get through the day. And that is how they managed their pain. And it might get them to a hip replacement or a knee replacement, or that's just how they got through their week. So I came to realize that it wasn't a matter of just getting high. That this was a method for pain management. If you do feel that you've consumed too much, then basically, you know, it's not like an opioid, which can be life-threatening. The majority of time, it's just a matter of staying calm and trying to ride it out. And that's why it's important to let people know that what you're doing. If you have an underlying condition, like a cardiac condition or something like that, that this can worsen, then you absolutely need to go into an emergency room, but you shouldn't be driving yourself. And you shouldn't be driving if you're using any kind of medical marijuana. So from a psychosocial standpoint, I think we're almost, we're done. You know, you should be talking to your providers about this. Many people don't want to, and I can understand that because of the federal issues and the federal risks, but you should include this in your conversation with your provider. You have to know the legalities of it. You shouldn't be driving. You should lock up your medications, keep them out of reach of children as well as pets, because they have a much higher risk of overdose and they have more side effects associated than an adult who might be using that. So in conclusion, remember, CBD hemp is qualified as having less than 0.3% THC, and that is legal at the federal level now as of 2018. Cannabis that contains THC is much more potent, and it's still illegal at the federal level, and you have to take that into consideration, even if it's legal in your state, as to how that the repercussions might help you. Although there's benefit to it, there are still risks, and you again need to take those into consideration. There's nothing out there that is a magic pill that's going to not have any kind of side effects. So you need to understand what those risks are, whether they're personal, medical, or legal. Find a reputable source and educate yourself on that, and then work with your reputable source. Don't get it from the internet. So these are some resources that we have available to you. I'm going to come back to this. These are our sponsors for tonight, and we do have an evaluation. It's the link is in the chat box, and then you can also scan that QR code to evaluate this program. And we'll make those resources available. And Sarah, if there's any questions, I'm sorry that we're after the top of the hour, but certainly open to any questions that are out there. Hello?
Oh, hi, Michelle.
There we go. I hear you now.
There we go. Oh, sorry about that.
I've been talking for an hour myself.
Oh, Sorry about that. I looks like I unmuted the wrong line. Sorry, folks. But I just want to say thank you so much for that presentation. That was really informative, and I think everything you covered from the history to how this affects the bleeding disorders community was just a very well done. Quick note that I did share the survey in the chat, so if you have a minute to take that, we'd appreciate it since it is at the top of the hour. We understand if folks need to go. I do have some questions that I'd love to ask you now. So somebody asks, does cannabis affect platelet levels?
Not that I've read. I've not heard anything or read anything that cannabis will have an effect on platelet levels.
Great, thank you. One other question that somebody said, they're wondering the difference between medical marijuana and recreational. They said that they're just still kind of having a hard time understanding between the two. Would you mind maybe sharing a little bit more about that? I think especially given that we have a couple New England states where there are some differences and legality. That would be great.
Yeah, so it was interesting. I went to a medical dispensary in Colorado, and next door was a legal dispensary. And you're not allowed into a medical dispensary unless you have your card carrying. And that's the same in all states. They'll stop you at the door, and you have to be a proven patient. When we ask them that question, their product is the same. Whether it's on the legal side or whether it's on the medical side, it was the same. The packaging might be a little different, but it was basically the same product. The big difference was the taxation. Now, I understand I saw that there was an expert out there. I would be interested if they thought there was something different, but that was the explanation given to me in a dispensary, and I have not seen or heard anything to refute that. So that is my understanding.
Great, thank you for sharing that. Another question that came in, you spoke a little bit about the rates of people who report substituting medical marijuana for opioids, and is there any thought about maybe it increasing medical marijuana use versus given these results and what it's saying is a substitution, since we have an opioid epidemic in this country?
That's an excellent thought, and there are those who would support that. There are those who feel that we have plenty of treatment options and totally don't believe in cannabis. So it still is a hot topic, an issue of concern. I think that some of what I've read says exactly that. When we look at the overdose rates in adults for opioids and the risks associated with them compared to the risks of cannabis. Again, cannabis doesn't come with a get home free or get out of jail card free type of thing. There are side effects associated with it. But they're not severe when compared to opioids. And so should we be looking at this as more of an option? It's not going to be right for everybody. It's not going to be as effective for everybody, but might it be another option? And should we be considering that? There are many out there who feel that we should be. And so, I'm not here saying that everyone in the audience should try it. It's just that if this is of interest to you, if it is something that is not going to cause you problems from a legal perspective, the federal versus state issue, and you're willing to give it a try, then that's something for you to consider if it can help you stay away from opioids or decrease your opioid use. The other thing you need to consider is the financial repercussions. Is that there's no coverage for this. It's all on a cash basis. So where you might have a copay of $5, $10, $15 for your pain medications, you have to pay out of pocket, and it might be quite substantial. You can't use your flex benefits for medical marijuana. So those are all things that you have to take into consideration along with any decision making that you make. And these are all individual personal decisions that everybody has to make.
Great, thank you, Michelle. That was helpful to know. I'm curious also, could you tell us a little bit about if insurance will cover medical marijuana, and would it cover recreational?
No, it will not. You cannot, again, you cannot use insurance. You cannot use your flex benefits. And in many states, Colorado has figured out a way to use credit cards, but I don't quite understand that. But in almost every dispensary I've ever visited, it's a cash basis. You have to pay cash. You cannot use a credit card for this either, because credit cards that are at a federal level, they go across state lines, and that makes it a felony. A federal felony. So this is all on a cash basis because of that federal designation of being a Schedule 1 medication.
Oh, great. Thank you for shedding light on that. I know insurance is a big question a lot of people are often wondering about. One final question, just in light of everything that's happening with COVID-19 right now, I'm wondering if you're seeing any information about medical marijuana being used kind of at increased rates to help people through this difficult time, particularly with mental health, stress management, or if you've seen any research to suggest that, we may see increased rates of use, as people continue to navigate this, and maybe some PTSD and other challenges related to COVID.
I've not seen anything about cannabis from the cannabis perspective. What I've seen is that many states consider the dispensaries to be essential areas, and so are allowed to remain open, and their workers are considered to be essential workers, which is wonderful. I understand not every state considers that. So, I think those states that consider it essential medications are very progressive in understanding the importance of having this available for people. So that's about the best I have heard or seen, knowing that there's going to be a lot of mental health issues as a sequelae or a consequence of this COVID pandemic. I would see that this is going to be an area that could garner more research and more areas of interest.
Great. I wanted to share, we actually just got one more question in. The person asks, is MASAC recommending HTCs certify patients for medical cannabis?
MASAC is not making any recommendations like that. We do have a pain initiative group, and one of the things that we have done recently is to develop some guidelines on chronic pain management. We have done a survey of our providers, and in that survey, we have asked specifically about HTCs and their willingness to write for cards, for medical marijuana cards, and to be open to that. So we do have that information. We're in the process of developing a slide deck on that survey, and that would be included in that. So specifically, are they recommending that? No, but they are asking providers about looking at alternative methods of pain management, and that is one of them.
Great. Thank you very much. And I wanted to share, we just got a comment that somebody said, this has been very informative. Thank you, Michelle. So kudos to you. I think this is certainly a needed presentation and one we're thrilled to have included. I also just wanted to give a quick shout out to the folks joining us from Vermont tonight. Someone noticed that on an earlier slide, Vermont wasn't marked off with the kind of federal and state slide on if where is marijuana legal, and I know Vermont is in the fully legal category there, so just wanted to
Was it
make
fully legal now there?
Yeah, it is in Vermont. So I just wanted to make a note of that again, just with Vermont being in our territory. And Michelle, no worries. It's simply for the fact I wanted to point it out there for those of us who are joining from Vermont. We certainly appreciate the presentation. It looks like slide 11. Yep.
Oh, I totally missed it, didn't I?
Yeah.
I'm so sorry. It's here.
I know those things happen. So just know that we do have that included, and we certainly appreciate you guys joining us who are from Vermont as well as throughout the New England region. So again, Michelle, really appreciate the presentation tonight. We will make a recording of this available for folks and have it on NEHA's website. As a reminder, if you haven't already taken a moment to complete the Survey Monkey in the chat, we would ask that you please do that. We would love to hear your feedback. And again, we really appreciate NHF for helping to put on tonight's webinar. I wanted to share just a couple other things. We do have another webinar Wednesday scheduled for next week, so stay tuned for one covering stress and managing your mental health in times of uncertainty. As always, we'll continue to put resources on HFA's COVID-19 page on our website, so please continue to check back for more. We've got lots of virtual programming happening now. And just a reminder, if NEHA can continue to be a resource for you, please don't hesitate to reach out. We are happy to support you in any way that we can right now. So again, thanks to everyone for being on tonight's webinar. Huge thanks to Michelle as our presenter, and we look forward to seeing you on a future webinar. Good night.